Julia is a patient. So I've met Julia with it in my journey as the clinical nurse advisor for Zivaris, and her story is really interesting. So, Julia, can you please tell us your story and how chronic edema has affected your life? What do you wish had been done differently? And now that you have a bit more information about your condition, we'd really love to hear your story.
Okay, so I have to say, listening to all three of you, it is quite upsetting, really, to know how I've suffered for 24 years unnecessarily. My real journey, I suppose, started in 2001 when I had a really chronic cellulitis in my right leg. And I was on methotrexate at the time for psoriasis and arthritis. And nothing would help the cellulitis, and they were actually talking about amputating my leg. And I woke up 3 days later not knowing if my leg was there or not. The priest giving me the last rites, and luckily they had managed to save my leg. And even in hospital, I couldn't get the care that I needed. They wanted to have all these different treatments on my leg, and then my father used to come in every day to put wraps on my legs because the nurses wouldn't do it. That leg took nearly a year to heal and has never, ever been completely clear from my knee down to my ankle. I've always had some sort of open wound on it or blisters on it. Very badly, what I thought was scarring, but obviously it's, the venous underneath. But no, I had no aftercare whatsoever after the time I left hospital. Dressed it myself at home. 2005, I had more or less the same thing happen in my left leg. Again, absolutely no aftercare from the time I left hospital. And in hospital, funny enough, both times I was under a diabetic consultant. Didn't see anybody other than diabetic consultant. I've had diabetes. Funny enough, the very first time I had cellulitis, I didn't actually have diabetes then. My diabetes didn't start until 2004, and I've been on insulin since 2008, injecting 5 times a day. My legs have been, as Katie has told me now, champagne shape. I am overweight. I've always been overweight, and I've struggled with battling with my weight all through my life. I've been on every diet known to man. I have lost 4.5 stone in the last 2.5 years under the guidance of Dr. Adrian Parks at bariatric surgery, the bariatric department, Adam Brooks. I can't actually have bariatric surgery because my liver is in decomposition and I can't have a general anaesthetic. In December, 1st December 23, I caught my leg, tiniest little cut, no bigger than my fingernail. I contacted the doctors and asked them, could I have some antibiotics? I knew my leg would get infected. They wouldn't give me any antibiotics. They said I had to wait until it was infected. It got really quite nasty over the next month. I had no help whatsoever, and eventually I don't think I actually started going to the nurse until February. At no time was compression mentioned. I was seeing a nurse once a week. My leg was leaking profusely. I would come out of the shower, sit on the edge of my bed to dry my hair, and I would have a puddle around on the floor where my leg was leaking so badly. Eventually the nurses started dressing my leg once a week. It used to smell horrendously. I wouldn't be able to go out because the smell would be so awful. They were sealing the dressing with a MeFix, which obviously with psoriasis and with my damaged leg from the cellulitis, my skin's very thin. So MeFix definitely wasn't something that should be put on my leg because I know it breaks down the skin as well. My leg went from having a very small blister on the side of my leg to then encroaching on my calf and moving up towards my knee. It wasn't until June that it was suggested that I saw a tissue viability nurse. An appointment was made for me, which was cancelled by the practice manager because apparently I wasn't bad enough to see the tissue viability nurse, which was quite upsetting. I didn't actually get to see Katie until November. So that was actually 11 and a half months after the injury first occurred. Compression was first mentioned to me in the October by a practice nurse. She did a Doppler. She took all the measurements for compression and nothing was ordered. It wasn't until I saw Katie in the end of November, 22nd of November, that Katie actually measured me again, got the wraps ordered for me and delivered them to me. And I've been in compression since then. I have suffered terribly with my leg over the last, well, it's now 16 months. I have been very depressed. I didn't realise actually how quite depressed I was until about 6 months ago. It's very hard to talk about it because I do get upset. I've had occasions where the nurses opened my dressing and there have been maggots in there. I don't know how. I mean, there's been no way for a fly to get in and lay eggs. I've had people comment when I've been out about how badly my leg smells. So in the end, you don't go out. And of course, if I've been overweight and not been able to get out and walk and exercise, it has made my weight loss stop. Actually, I've plateaued because I haven't been able to continue the exercise that I was trying to do. And it's just affected my life completely. I mean, the pain has been horrendous. Since I've been in compression, the pain was almost gone. My leg is actually like a normal shape now, which is wonderful. I didn't realise how misshapen it was. The wound has almost cleared now with Katie, with the compression dressings on. I do know that I will be in compression wraps now probably for life, which although is uncomfortable and probably not very attractive, I know that is the only way that I'm going to keep my legs healthy and probably ulcer free. I just wish that someone had told me about this 24 years ago. My life would have been very, very different. Even on holiday, when you're walking around and people stare at you and make comments about how bad your legs are, and they will ask you, it's embarrassing and it's upsetting. And all of this could have been avoided with education to myself and also to the nursing staff. And the nursing staff, I've been to have my legs dressed before now, and says, sorry, we've got no dressing support on your legs. And that was basic dressings, not compression even, just basic dressings. And I just think everybody has got to be educated, because I am not the only one suffering like this. I'm not the only patient in my surgery, every other surgery, and in a community that is suffering the way I have suffered. And it has got to be through education. So I don't really know what else you'd like me to say, Katie, but I mean, that's my story. I mean, it isn't helped the fact I've got diabetes, I've got a spleen, I've got portal hypertension. I know all these things now are a contributing factor, but the compression, even with all the contributing factors, would have stopped what I've been through, especially for the last 16 months. And I can only thank you, Katie. I can only thank you for what you've done for me, because you have actually, as you know, you've given me my life back, really.
You, Julia, and thank you. I know how hard this has been for you to share your story, and
it's upsetting when you talk about it.
Yeah, you've been through so much, and what is, really upsetting is that it could have been prevented.
Absolutely.
And with your complex medical history, and the chance of you losing your leg is a story we hear quite often. So you should have been even more been given the opportunity to have some compression to stop these skin changes in your leg. So now your leg, we've spoken about it, is a more advanced stage. You've got, these lots of skin changes that you can see in your legs, which is all result of that chronic inflammation over time.
Absolutely. Can I also one other thing, if I may add, is that I haven't had the nursing to be able to dress my leg. I'm physically unable to dress my leg. luckily my sons, and I have a very good friend who's a nurse, have done it for me at times, because I haven't been able to get it from my nursing practice or my doctor's practice. And the times my sons have said to me, Mum, you are going to lose this leg. It has been so bad, so badly infected. The compression has stopped it all, has absolutely stopped it. I can't stress enough how important this is.
Yeah, absolutely. Thank you so much, Julia.
Thank you.
I'm sure everybody, really knows lots of other people in your situation. And Professor Rabe said about the prevalence of chronic edema, it's huge, and we know that it's preventable. So thank you so much for coming on and share your story.
Well, thank you for inviting me on. It's been a pleasure, a privilege to be able to actually tell my story. I haven't always gone into it as far as I could do, but it's, I just honestly can't stress enough how important this is.
Try and make some changes. And like Claire was saying, with patient education, you now know what needs to be done with your leg. So you can go armed with the evidence about how to prevent your leg from getting worse, how to prevent cellulitis infection. We saw from that study that, it halved the chance of you getting cellulitis again, which has been in hospital before and other patients. So thank you so much.
Well, thank you.
Oh, you're welcome. I think we may have a couple of other questions. So I'm just having a look on here. So Sylvan, so I think there's just a little bit more about the heart failure. So that's great. You should all be able to see on there. So he's just put a link on there for some articles in phlebology, where it does talk about the New York Heart Association diagnostic tools, which we definitely use in the UK to assess our patients. It gives you a real good indication about if you can apply compression safely or not. There's been lots of research done recently on that. And I think we got a question from Margarita. I am not fun on below knee garments for me, as they are useless and don't make sense. They will build up edema on the upper leg. Thigh or panty will address the problem. So definitely, if you've got edema which is above your knee, you need a thigh or a tight or a panty style garment. Wherever the edema is, that needs to be addressed, which Claire, I'm sure you've seen, many you'll see many patients where the edema has just been addressed below knee and not always above knee or around the knee. So that is something we should always be assessing. And we've just got Peter commented, thank you for sharing your story, Julia, and sorry to hear you suffered with it so long. What advice would you give to patients going on this journey?
I think is to actually ask more questions of your medical practitioners, rather than just taking their word for, we can just stress it once a week, we can only do this, we can only do that. You have to press for better healthcare, and because it's out of all the practice, all the nurses and healthcare assistants at my practice, there was only one healthcare assistant that was dressing my leg correctly. And I know they're educated. I know, speaking to Katie, they have been educated. They just haven't or aren't taking the time to pass that education on to patients, to tell them about compression. It was 11 months before it was mentioned to me. I mean, that's outrageous. Well, actually, it's 24 years, isn't it, before it was mentioned to me? Why wasn't this told to me 24 years ago? I mean, obviously, maybe the studies over the years have improved, and, we do this, Professor Raab has done the studies, and we get to learn more and more about our bodies. But even if there was just a pamphlet in the doctor's surgery, they have all these stands and everything on. Even if there was something, you're sitting there looking at things, you'll pick up a leaflet and find out about it. Maybe that's something, that could go forward, is even a poster in each doctor's surgery warning of edema. I mean, I was told, I think back in June, the nurse suggested that I had diuretics, because my leg was literally, it was like a tap coming out of my leg. And I was told, you can't have those, you've got kidney failure. Well, no, I haven't. And I saw a doctor about it a couple of weeks ago. No, I haven't got kidney failure. So I actually could have had a diuretic, which may have helped, 6, 7 months ago. And it's this lack of communication between the doctors, the nurses, the healthcare assistants. It is literally the lack of communication or lack of education. And I don't really know what advice I can give other than you must press to get help, not just accept what you're being told. If it's going on months and months and months, you just have to ask those questions. What more can you do for me?
Yeah, I know we've been trying to put lots of more information on our website. So we want to update more of our patient section. So then, because more patients now are using the internet so that we can find out about our conditions and what they need to help. But that's a great idea about maybe having a leaflet, because I tell people all the time, ankle swelling is not normal. We shouldn't be having even ankle swelling. And, I hear, well, I'm just getting a little bit older and, I have some swelling to my ankles. But that's just a very early sign that there's something wrong. So
Well, I've always had it blamed that it was arthritis. It's your arthritis why you're swollen. No one has ever said to me about edema until I saw you. And I'm 61 and I've probably had it, I don't know, at least half my life. And no one, no medical professional, no doctors, nobody has ever said to me until I saw you, you have edema. Why not?
Yeah, and it's been around, I think, from even the I think it was the Egyptians actually that first started using compression. So so I haven't got all the facts on that, but from my studies of being a nurse, I know that they were like wrapping legs and dealing with these problems. So we do know that chronic edema, venous disease, lymphedema, they have been a problem for a long time, and the evidence has been out there, the treatment that is needed. And I know within the UK, there's been a lot of work done with the National Wound Care Strategy and the Legs Matter campaigns to try and get awareness out there. But I really do feel that we may need to empower our patients with the knowledge so that you can ask for the care that you need, because we've tried to leave it with just the healthcare professionals, and sometimes they just don't have the courage or they're not supported to deliver this care. But anyone that is a healthcare professional,
probably comes down to finance as well. Lots of it, unfortunately.
Yeah, I think that can always have somewhere to play. But okay, thank you so much. Thank you so much for all of you in joining this topic today. It's been a real eye-opener and very moving, your story, Julia. And Claire, thank you for being so honest about what it's like to be in the real world as a nurse. And it was a great honour to have Professor Rabe here. If there are any further questions, please reach out to us as far as head over to our website or our LinkedIn pages, where we put lots of sources of information and education and talk about real world concerns that we have about how we can maybe deliver better practice for our patients, and of course on the MOH educational platform. But from all of us today, I think that's it. If everybody has anything else to add before we leave.
No, I'd just like to say thank you very, very much for the education. I've actually learned an awful lot today from all of you, and I'd like to thank you for that.
Thank you so much, Julia. People will really appreciate you being on here today, and that takes a lot of courage for you to come on and share your story. So thank you, and I will be seeing you soon.
Yes.
Okay. Take care, Julia. Thank you.
Thank you. Bye-bye, everyone.
All right. Thank you. Thanks, Claire.